Hi, my name is Kathy G, and I'm a refractive surgeon here at ClearChoice. Vision is absolutely essential in our everyday lives, and I'm honored to have the privilege of working in the field of ophthalmology, where I have the opportunity to restore vision in my patients. Ever since elementary school, I've been wearing glasses to correct my strong nearsightedness. Every year it seemed like my glasses prescription increased, and eventually my glasses were pretty thick. So I decided to wear contact lenses, which were great for several years, but eventually they became very uncomfortable. That's when I decided to consider refractive surgery. Now, I am a refractive surgeon, and I've seen how transformative the results are for patients. But when it came time to consider refractive surgery for myself, I was still very nervous, just like most patients are. Because I had a really strong prescription, I was about a minus 8.5 with astigmatism as well. I wasn't a candidate for a corneal-based procedure like LASIK, SMILE, or PRK. I actually was a candidate for something called an implantable contact lens, or ICL. Being familiar with the procedure and the technology, I knew that this was best for my eyes. But even still, on the day of surgery, I found myself pretty nervous. But with some extra medication, I found myself very comfortable and really surprised at how quick everything was. The next day when I woke up, I was just blown away by how clear everything was without having to reach for my glasses or contacts, really details that I had never seen before. And I can't stress how much I would recommend refractive surgery to any patient considering it.
So I had what's called radial keratotomy, and it was a procedure that came out before LASIK. So my father's an ophthalmologist, and I remember when I was in college, I was wearing glasses, and if I didn't have my glasses on, I couldn't see the board. I'd walk around campus, and if I didn't have my glasses on, I couldn't see, across the way, and people would wave at me, and if I wasn't wearing my glasses, I couldn't see anything. I just remember I never really noticed how clear things were. Even looking out the window, I always thought trees were just sort of a green blob, and everything was just sort of green. I was like, wait, you can see the actual leaves, and looking at the forest and walking around campus, I could see people that I knew. And so to me, it truly was life-changing and just kind of gave me this new outlook, and it was a great experience.
Before I had LASIK eye surgery, I was extremely nearsighted. It was about a minus 750, and I went several years where I was actually performing eye surgery on these patients, and I would see that they would have patients that had the similar prescriptions I did, and these patients did fantastic. They would see great. So finally I went ahead and said, if I need to practice what I preach, so I went ahead and decided I'm going to go ahead and have the procedure done in my own eyes. What I can remember is the day that I had the procedure done, I was extremely nervous. I wasn't sure exactly if this was the right thing or not for me. I wasn't sure if this is something that is going to work. Will I be able to function after surgery? What's going to happen? And while surgery is going on, you always feel a sense of loss of control, not exactly what's happening. What was great is the procedure itself was completely painless. It was very quick. And the nice part is the next day I woke up and to be able to see things that I've never seen before. And literally 2 days later, I was operating. So it was something that was a life-changing experience for me.
A lot of people may ask, why do we have all these lasers in our laser suite? In some offices, maybe they just have one laser. And the reason we've invested in so many different technologies is mostly to try to get the right laser for the right prescription. Each patient might need something specific. In general, maybe you could have one laser that treats everybody pretty well, but there's sort of unique situations that one laser may treat one eye better than a different laser. And we're trying to get the best outcome for each individual patient. So, one patient may go with one laser to create the flap and a different laser to treat the prescription. We have multiple different combinations that we can use to get the best outcome. So we're always just trying to push that bar to have either more patients. Some patients maybe weren't candidates with the traditional technologies. We might have a new laser that allows them to now be a candidate, or it just might be something unique for that certain eye that we have to have some special laser to get the best possible outcome.
I treat the patient like I would like to be treated, because I want the greatest amount of technology that's available, the greatest surgical experience that's available, so then the patients get the greatest results that we can give them.
Welcome to ClearChoice Custom LASIK Center. We're glad you chose us. The purpose of this video is to give you an overview of our practice. If you have any specific questions, our highly trained counselors will be able to answer any of them for you after this presentation. Feel free to stop and rewind along the way. You can take as much time with this video as you would like. Choosing ClearChoice was a great decision. We are committed to being at the forefront of laser vision correction and using the latest technology and techniques for our practice. There are many things that contribute to the ClearChoice difference, but some of the biggest factors are experience and technology. Our surgery suite contains a wide variety of lasers, and this gives our doctors the ability to match every patient's eyes with the right technology, as well as the option to offer a wide range of procedures. Based on their experience, the ClearChoice surgeons will use the technology that will give you the best result. And when it comes to options, know that not everyone can offer what ClearChoice can. The ClearChoice surgeons boast a lot of firsts. Here are some of the ClearChoice surgeons' firsts. First, in the area to offer all laser LASIK. First in the area to offer the WaveLight Allegretto. First in the area to offer the Catalyst Laser Cataract System. First in the area to offer Aura technology. First in the area to offer Smile laser treatments. First in the area to offer Hydrus microstent. First in the area to offer the ICL with astigmatism correction. You can have all of your preoperative and postoperative care at ClearChoice, or we can involve your own eye doctor. This can be helpful, especially if you live a distance from our center. ClearChoice offers LASIK, PRK, and Smile. Each procedure is performed a little differently, but they are all able to improve your vision. Your doctor and your vision counselor will help you to understand which procedure and laser technology will be best for you. We are now going to show you some animations about the different laser vision procedures that we offer.
LASIK surgery begins with you entering the laser room and lying down in a relaxed position on the procedure bed. Next, anesthetic drops are applied to numb your eye. The surgeon will then position you properly under the laser machine. A painless lid-separating device will keep you from having to worry about blinking or closing your eye during the procedure. Next, your doctor creates an ultra-thin flap in the cornea using computer-controlled laser pulses, which pass through the top layers of the cornea to form microscopic bubbles at the optimum depth and position, gently separating the outer layer of the cornea from the layer being treated. Your doctor will then gently lift this flap and hinge it back, out of the way. You'll be asked to fixate on a blinking fuzzy red light, and your doctor will precisely align the laser beam with your eye. When everything is just right, your doctor will activate the laser. Painlessly, computer-controlled laser light pulses will remove microscopic amounts of tissue, gently reshaping the cornea. The pattern of laser treatment is determined by a sophisticated program and based on the detailed measurements that were taken during your preoperative examination. Before you know it, your procedure is over, and the surgeon will gently reposition the flap, smooth it with a special medical sponge, and allow it to dry for a short time.
Photorefractive keratectomy, also known as PRK, is a procedure that corrects vision by reshaping the cornea. This procedure can be used to correct nearsightedness, farsightedness, and astigmatism. First, anesthetic eye drops will be used to numb the eyes. No injections or needles will be used. Next, the surgeon will remove the epithelium, a thin layer of protective skin that covers the cornea. Then, computer-controlled pulses of laser light are delivered to reshape the cornea. The laser will be programmed with the information gathered in your preoperative exam. The laser treatment will be completed in less than a minute or two, depending on the amount of correction needed.
Small incision lenticule extraction, or SMILE for short, is a procedure that helps correct myopia, also called nearsightedness. Much like LASIK or PRK, SMILE uses a laser to reshape your cornea, which corrects your vision. To improve your vision using a laser, your doctor needs to make the correction in the middle or stromal layer of your cornea. In PRK and LASIK, the top layer of the cornea is removed or peeled back in order for the laser to access and reshape the stroma. However, in the SMILE procedure, the top layers of the cornea stay intact. A laser creates two thin bubble layers within the stromal layer of the cornea, creating a disc-shaped piece of corneal tissue called the lenticule. The surgeon gently removes the lenticule through a small incision. Removal of the lenticule permanently changes the shape of your cornea, resulting in better vision. The SMILE procedure may be a better option for those prone to dry eye or people who have active lifestyles where the LASIK flap could be dislodged due to eye injury. It is also a good option for those seeking a fast visual recovery with low post-operative risk. Most patients return to their normal routines just a few days after the procedure. Give yourself another reason to smile. Talk with your doctor to see if the SMILE procedure is your path to better vision today.
Patients who are age 40 or above have more to think about. Here is some information about the aging of the eye.
Monovision is a strategy that addresses the problem of presbyopia, in which people over the age of 40 begin to lose their ability to read or see up close. Traditionally, this age-related loss of close-up vision has been treated with reading glasses, multifocals, or contact lenses. Monovision is a technique that involves correcting one eye for distance and the other eye for near or intermediate vision. When both eyes are open, the brain can choose to use the distance-corrected eye to see far away and the near-corrected eye to see up close. Many people get used to monovision right away. Other people feel a little imbalanced at first, but get used to it within a matter of days or weeks. Some people cannot make the adjustment to monovision and are better off not choosing this approach. Simple testing can help determine if you are a good candidate for this procedure.
Not everyone is a candidate for laser vision correction. Clear Choice offers alternatives to laser eye surgery for those who are not. There are a small number of patients that could need a LASIK enhancement in the future. Your counselor will talk with you about our vision enhancement options. Our goal at Clear Choice is to provide the best experience every step of the way on your journey to better vision and for you to achieve the best vision possible. And it doesn't need to end here. The doctors at Clear Choice also own the Cleveland Eye Clinic. The Cleveland Eye Clinic offers general eye care and services such as cataract surgery that you may need in your future. Thank you for watching. This concludes our overview. Please let one of our staff members know that your consultation video is complete.